Hello, my beautiful people. Happy Mental Health Awareness Day. It is the 10th of October 2020, and we are finally honoring this day. And for me, what topic that came to mind that I felt it's important to raise awareness on is prenatal and postnatal mental health issues. Do join the conversation. I love to see your comments and your questions. I'm speaking to both men and women. I'm also speaking to family members. You might not have a child, but you might have somebody that you know that has a child. I'm also speaking to colleagues and employees, as well as friends. Be aware of this condition that just lurks on you unexpectedly. So remember, we're told even from a very delicate time in our lives that pregnancy is, a beautiful time, and it's nice to have a baby. And we see pregnant women, some are angry and some are very happy, and we don't really know what is going on with them. And there is something that goes on with women through pregnancy, and some men also experience these hormonal changes. And yeah, it's exactly that. We go through hormonal changes, and obviously that causes changes in terms of chemicals in the brain structure, and therefore affecting behavior. So prenatal mental health issues are very much a risk factor for women because they experience variations of hormones during pregnancy, and that obviously affects their behavior. So you've seen an angry pregnant woman when she's asking for your food, or when she wants something from you, or 1 minute she's crying, the next minute she's excited, and you don't really understand what's going on. It's those hormones. And remember, if I think it's a right time now to just define mental illness. Mental illness is a range of conditions that are due to hormonal imbalance. So remember, a person can have a mental illness or a mental disorder, but they can also have mental health issues. So if there is a hormonal imbalance, people do experience mental health issues. And this is very common with women during pregnancy, that they experience difficulty sleeping, difficulty, eating. Some are experiencing morning sickness, nausea and vomiting throughout most of the pregnancy. So their appetite has also changed. Their eating habits have changed. Their sleep has changed. Their social participation has changed. Their bodies are changing. So self-image, self-confidence could be, better for some women, but for some women not. And their skin changes, and all of that because of hormones. So one can note there that it can lead to mental health issues or mental illnesses in the long run. So there's something that I want to mention about mental illness, is that how it ends up being a fully blown mental illness is that something needs to happen excessively, repetitively, over a long period of time. So say, for example, you see a rat in the house, and then you see a rat in the house in the kitchen. Every time you go into the kitchen, you're going to anticipate that the rat will be there, and you'll get you'll feel scared. So you get a fight, flight, or freeze, depending on how you respond to danger. So your brain releases a hormone for you to react. So every time now you go to the kitchen, you're going to feel that anxiety, that fight, flight, or freeze, because you're anticipating to see the rat in the kitchen. If this happens over a prolonged period of time, and it's excessive, and it's also repetitive, it can lead to a disorder, because your brain is now releasing a hormone time and again to alert you that there's danger, even when there's no danger. Another example is anyone who's been in a car accident, or anyone who's been hijacked. Every time you're driving, you're looking over your shoulder, you checking if your doors are locked. You're looking at everyone around you. You look at every car that drives behind you, whether you're being followed or not, because you're afraid, or your brain is alerting you that you could be in danger. And if this happens for a long period of time, because maybe you didn't get support or you didn't go for therapy so that you could address the trauma, it can lead to a condition like post-traumatic stress disorder. So it becomes a disorder now because your brain is releasing that hormone of fight, flight, or freeze, even when there is no danger. So now that is how it becomes a disorder. That is now how it becomes a mental illness or a mental health issue. So today I'm talking about prenatal and postnatal mental health and wellness. I want to speak to men as well and women, family members, like I said, and let us talk about this. You guys might have heard about baby blues, where after a woman gives birth and they start feeling depressed, they start feeling disconnected from themselves, disconnected from the child, they can't bond with the child, they're having difficulty carrying the child, or they want nothing to do with the child, and you don't understand why. I'm specifically speaking about this today because it's Mental Health Awareness Day, and it's International Mental Health Awareness Day, and the theme color is green, so please wear your green ribbon. So you'll find that the woman will have difficulty bonding with the child, and the woman doesn't understand why they're having difficulty bonding with the child. There's also prenatal depression, where the woman is depressed throughout the pregnancy. It can vary from mild to very severe, where the woman would need admission to be monitored, because sometimes if the person is feeling depressed during the pregnancy, they might also have suicidal ideation, which is thinking about suicide, and some women might have a plan of suicide while they're pregnant. And remember, this is all because of the hormonal imbalance happening in the brain, because when a woman is pregnant, there are so many hormones that change and cause instability sometimes in terms of function and behavior. So some women do need to be admitted during their pregnancy because they are experiencing depression or anxiety, or some of their past events, like maybe being raped, which is a huge trauma, or being, in a car accident, or having had a miscarriage before, or having had an abortion, and worrying, or having had a child that was born with special needs, and now they're pregnant again, and they keep stressing and worrying about how or what's going to happen to this baby. They may end up falling into depression. Can be mild to severe, as I said. So some do need admission, some do need medication, but all definitely need therapy. They definitely need therapy to deal with their issues. They definitely need therapy to be able to cope with the pregnancy on a day-to-day basis. So there's another one, which is prenatal anxiety, where you experience a sudden fear, and you're just afraid for everything. And you're scared to drive out, you're scared to get out of bed, you're scared to walk, you're scared to be functional, basically. And you can imagine if you're walking around anxious most of the day and you're pregnant, which could be due to a past trauma, or it could be due to genetics, because with mental illness and mental health issues, there is genetics also plays a huge role on whether a person can be diagnosed or not. So you feel anxious about everything, and you feel like something bad is going to happen at any moment. So you can imagine somebody feeling like that, and they are pregnant, and that can be really, really debilitating to function. Things like sleep, how are you going to sleep when you're feeling anxious? Things like rest, like going to work, like being in social situations, driving. So many areas get affected when you have prenatal anxiety. Now, for me, having 2 kids, I can tell you and I can attest that the issue of giving birth should be as natural as possible. But for some of us who gave birth via cesarean, I think it's one of the most traumatizing events. for a woman to face. And I think that is why when some guys go into the labor ward with their women, they struggle to take it because it's so traumatizing. So normal vaginal delivery, also I feel it's traumatizing because someone is coming out from your vagina, and that is like, especially with your first child, you're taught from a very young age that you should keep your cookie to yourself and whatnot. You're not used to, just being chilled about your cookie, and now you need to trust people that you've just met, that you don't know. They could have been your gynae the whole time, or they could be a new gynae or a new midwife, and now you have to just, give in and to intimate parts about yourself, which is very invasive, but it is unfortunately a process that we have to go through. So you feel compelled to go through the process, which is so traumatizing. For me, the thought of giving birth vaginally is really traumatizing. Like, the thought of it is too much, because I had C-sections with both my babies. And then on the other hand, going through C-section, going to theater, all those tools and equipment, and you know exactly what's going to happen. You can feel everything in terms of, like, you can hear everything, the sound of the tools and everything. And yes, you can't feel pain. You can feel a little bit of pressure, and you know what's going on, what the procedure is, because during pregnancy you research all these things. And if you are like me, you go to a labor ward and see what happens because you work in a hospital. So it's a very invasive kind of procedure, and it is also a major surgery. So and then boof, the baby's out, and then now you have to deal with yourself in terms of your healing and going through your own journey. And now you also need to focus on the baby. Then there's breastfeeding, which most women have been struggling with of late. That's why now there are breast pumps, electric breast pumps, and a woman will try everything so that they're able to give the baby the best milk, which they say is breast milk. And I also vouch for that. But if you can't give breast milk, it's still okay because we've got alternatives. So now you home, and it's a big change because now your body has changed. You need to get your body scheme right within your mind. And now you need to get used to having this little human being that maybe a girl or a boy, and you don't know what expectations, we don't know what expectations you had. You might have wanted a girl and now you have a boy. So you're dealing with all these changes and all these things that you need to accept. And now you have to deal with the baby. Then you get a baby that has colic, who is crying. They have episodes where they cry, and you will go to the clinic. You will keep going back to the hospital trying to figure out what's wrong with the baby. Is it something you're doing? You're tired from giving birth. You're tired from the whole pregnancy, and now you have to deal with the baby that has colic. And it's not your fault the baby has colic, and it's not the baby's fault that they have colic. Colic is basically what they call wind. It just means that the baby's digestive system is not well developed, so they struggle with digesting the food or the milk. So they also struggle to pass stools. So they use a lot of effort when they have to do that, and they cry a lot because they have wind in their tummy. So they cry a lot for hours, and it's not just crying; it's screaming. They'll literally turn red. Like, my daughter would turn red, screaming. And you would think, is it this? Is it that? And now you're dealing with that. And remember, during the pregnancy, you might not have been sleeping enough in any case, because hormones are all over the place. You might be sleeping at work, and then when you get home, you don't have any sleep. So you're used to this routine, that is on its own dysfunctional. And now you want to rest because you had a C-section, but now baby has colic. This is where now support comes in, and it is such a vital and important element to have in your life. Support, meaning people that will help you with the baby. In our African culture, we have women that will take care of you after you give birth for the first 3 months. They do almost everything for you except bath you, and they help to take care of the baby. And I think now that I think of it, this was a way to prevent things like depression and anxiety postpartum. And it helped a lot of women to find their feet and stabilize themselves. But these days, people hardly do that. People go back to their apartments, and some don't have nannies to help them. They don't have their moms to help them. Some of them don't want their moms, or they don't have moms to help them, or they don't want their family members at their home because they are still moody and cranky. So the support structure is then lacking, which poses as a risk for a person to develop things like postnatal depression and anxiety. So postnatal depression is basically depression after giving birth, and it obviously affects your mood, it affects your thoughts, it affects your behavior, it affects your level of energy, and also affects your function in terms of your self-care. So bathing, dressing, your self-esteem, obviously, for women who've gained a lot of weight or are losing too much weight or are not eating enough, not sleeping enough. Like, you can imagine how functional a person who's going through all of those things can be. So postnatal depression is you feeling a sad mood or crying most of the time, or being socially withdrawn, or being irritable, not finding it difficult to bond with the baby because you're dealing with your own emotions. And I specifically wanted to raise awareness about this particular topic because I feel we don't talk about it enough, and more than 30% of women experience postnatal depression and anxiety, especially during this pandemic, this time of a pandemic, because now there is too many comorbidities. There's loss of loved ones, there's this pandemic, there are financial problems, there are lifestyle changes, some of the children are away, there's things about work, loss of income. There are so many issues that have happened because of the pandemic. The things of wearing a mask in public, you can't go out, you can't shop with your baby, you can't go out and get some fresh air, you can't drive out and just for no reason. You need to go out to get essentials. So you kind of like in your home, cocooned with a baby that's not sleeping and you're not sleeping, and you've just had a C-section, and you probably have another baby to deal with, and your partner is there, but they can't really be within how you feel and all of that. So it does really affect your function. So postnatal depression is a very much serious condition. And postnatal, I can say, depressive episode is also a very much a serious topic that needs a lot of attention, which is why I decided on this Mental Health Awareness Day to shed light on that topic, So another one that I want to dwell on, I'm just going to go through my notes, is postpartum panic disorder, which was very common, especially with my patients this year. And I've experienced a bit of panic attacks myself postnatally, so I know firsthand how it's like to have a panic attack and feel like you're gonna lose it. So this type of postpartum panic disorder is a type of an anxiety disorder, and it basically affects your function, because if you're constantly feeling anxious, you can't really function. And sometimes you feel anxious for no reason and you don't understand why. So some of the risk factors are having a history of anxiety. So say like with me, I was held at gunpoint last year, and it was an attempted hijack, but it didn't happen. I was not hijacked, but that was a trauma. So now every time I'm driving, I'll look around if somebody's trying to hijack me, for example. And it's very traumatizing. I speak of it now so calmly because I've dealt with my issues around it. But that is a past experience of anxiety. So that is a risk factor for postpartum panic disorder. Another one is if you've been diagnosed with a panic disorder before, or you've had traumatic stress like being raped, or somebody being murdered in front of you, seeing patients die. Okay, I've seen a lot of patients die in front of me because they were so sick. Having multiple deaths in the family. I had that last year. I've had attempted house break-ins, 4 of them while I was pregnant. Those are all traumas that can make anyone panic. So those are things that your brain, your subconscious mind, registers, and then now you need to deal with the aftermath. And now you need to deal with those traumas through therapy, trauma debriefing, etc. And then if you've got a thyroid dysfunction, thyroid is so important in terms of hormonal balance. So you can go for thyroid testing if you feel there's something offish, and a doctor can refer you to go for a test to just see your levels, so that they can determine whether you're at risk of or you have a mental illness or mental health issues. A traumatic childbirth is also a risk factor. So like I said, if you've given birth before and it was just too much, like with my son, he was meant to be born normal delivery, but it was an emergency C-section because the baby was too big and my cervix was shut. So it was an emergency C-section because his heart rate was high and mine was low, and there was no way I was going to push that baby out. So we had to do a C-section. And remember that that is my first child. So that was a traumatic birth. And now, obviously, you're thinking, I could have died and things like that. So that can lead to postpartum panic disorder. Another one is just having negative experiences during childbirth. A lot of people will report that they were ill-treated in hospitals by different professionals, and for maybe their own reasons. I won't want to speak for them, but they've had traumatic childbirth. I've got a cousin of mine who gave birth at home and my granny had to help her. So that again could be a traumatic birth because she was expecting to give birth in a hospital because that's what's known these days to be, common these days. But it didn't happen like that. So she's getting into a car with the baby and the umbilical cord. That is traumatizing because you don't know what's happening, especially if you are not a medic or a healthcare professional. You don't know what's going on. And some healthcare professionals also don't know what's going on. So that can be seen as a traumatic experience in terms of childbirth. Another one is just fatigue and a lack of sleep. So like I said, with me, I experienced a lack of sleep because after they tried to break into my house, I didn't want to sleep because they tried to break in at 2 a.m. So every night at 2 a.m. I'd wake up and watch night watcher. I was literally a night watcher until I had to deal with those issues through therapy, obviously. But if you're not sleeping enough during your pregnancy or even after your pregnancy because you've got a baby that has colic and is just not sleeping, that also is a risk factor of getting postpartum panic disorder. Fatigue, not having enough energy to do things. Remember, after a C-section, you need to take it easy for the first 6 weeks or 2 months. So now you also need to take care of a baby, and now it's COVID-19 and people can't come to your house to help you, or, there's no access to much support as much as there would have been if there was no pandemic. So now definitely you will struggle with fatigue because your body is your body's being drained. Even with the help of 2 people, your body is still being drained, and remember, our bodies are not built the same. So like with me, I've got iron deficiency anemia, so I get tired quite easily, especially when I'm not on my iron supplements and I'm not eating the right food. So we don't have the same threshold. That is why even in my talk yesterday, I spoke about the fact that you need to know your threshold. This whole Mental Health Awareness Month is about you knowing yourself and knowing your threshold, how much you can take, how much does it take to get you to snap out of balance, and then be able to know that and be proactive about keeping yourself in balance and keeping yourself in check. And obviously, if you don't know what your threshold is, do see a therapist, do see someone who can guide you so you can know how much you can take in terms of situations, how many roles you can take, and how much of yourself you can give into those roles so you don't have a role overload and you have demanding roles at the same time. So you'd need an OT to sit down and look at your activity profile to be able to help you to balance out your activity profile and make sure that your life still has purpose and meaning, you know. So another one is poor nutrition. Obviously, if you're not eating right, you won't have enough strength. And some moms, like myself, struggled with appetite. I struggled with appetite during my daughter's pregnancy because I was throwing up every day for the first 6 months. So I didn't eat much in the mornings, and then in the afternoons I would eat junk food. So obviously that also affects how you present after or even during your pregnancy and after your pregnancy. So yeah, some of the symptoms of postpartum panic disorder, they can come suddenly, but they gradually worsen over 12 months after giving birth. So after a baby is a year old, you might see them starting to subside, if it's just an episode. But if it's a disorder, then they just worsen. Okay, this is difficulty concentrating and remembering things. Many women will know this because you'll say you have a mushy brain or pregnancy brain. It's when you're having difficulty concentrating and you can't remember what day it is, or you can't remember what you had to do. So it's important to write notes and to be aware of what you need to do, diarize things, have a to-do list and all of that. Difficulty completing tasks fully. You start cooking rice and mince here, and then you start baking there, and then you start this and you don't finish everything that you start. That's just an example. Being easily distracted. So while you're in a session, I don't want to discredit therapists out there but that are pregnant. This happens in a variety of ways. It can be mild, and some people do cope well with it. And the best way to cope well with this is for you to be aware of yourself. Be aware that, you know what, I can only take 3 patients in the morning, then I need to take a break, then I take 3 more patients, and that's the end of my day. Don't expect yourself to do exactly the same amount of work that you were doing before you got pregnant, you know? So yeah, being easily distracted is a very common one when you're talking to someone and then someone else comes in, and then you lose your train of thought, and you don't know how to continue the conversation because you can't remember what you were saying. A thing of being indecisive. I've seen this a lot with not being able to decide what to wear. You just have all these clothes on your bed and you don't know what to wear, and it's so dysfunctional because you've ironed everything, you've put out all these things, and now you need to re-iron everything and rework, and it's just a mission. Okay, inability to relax is a very serious one where you just can't sit down and quieten down your thoughts, you know. Insomnia is another sign and symptom, as well as fatigue, loss of appetite, feeling uneasy for extended period of time. So not feeling calm, just feeling jittery, you know, feeling overwhelmed, you know. I mean, having a baby it can be overwhelming because every baby's different. And I think with the second baby, it can be even more overwhelming because you're expecting it to be the way it was with the first baby, which it's not. So it can be overwhelming to kind of, even though you are as prepared as you can be, but baby will just sway you out because they are not the same as your first child. Like with my children, I have a boy and a girl, totally different experiences, but they both my kids, you know. So you could feel overwhelmed and sometimes feel worried about the baby or feel fearful. You know, these are all signs and symptoms of the disorder. Remember that. Okay. Feeling agitated or irritable. Avoiding things because you're fearful or you're worried that something bad will happen. So avoiding going to the shops with the baby because you're scared you might cause an accident. And I think with COVID, it was more serious in that avoiding going shopping with baby because you think you might get COVID, which is like an in-your-face type of, you know, fear. It's not an irrelevant fear, but it is quite valid, you know, as a fear. Then experiencing what we call agoraphobia, which is basically a fear of being in the open. and a fear of being in public spaces. So, like malls, taxi ranks for those who use taxis, park areas, family gatherings. It's just like too much for you. I've seen a lot of women with children in families, during the family gatherings, you'll find them in bedrooms. So remember, for a disorder to be diagnosed as one, you need to be experiencing most of these signs and symptoms for you to be diagnosed. So you could have one or two, but it doesn't mean you have a mental illness. It means you have mental health issues related to postnatal panic disorder. But it's an episode or an issue that you have and you need to deal with. Okay. And it's good to deal with an issue while it's still an issue, rather than leaving it over a prolonged period of time where the event is reoccurring, which then again, like I said in the beginning, will definitely lead to a mental illness. Okay, some women experience suicidal thoughts, feeling like, I don't know why I gave birth to this baby. Maybe I should just die. My life is a mess. This will never end. I'll always be on maternity leave. I'll never see my friends and family again. I'm stuck in this life. They'll say things like that to you. And then they'll also attempt suicide, where they try to drink pills, or they, overdose on pills, and tie themselves up on a rope or drive themselves into a tree or whatever. There are many cases of women who've done that and left children abandoned, or left children without mothers. Okay, so, and then the last of the signs and symptoms is having panic attacks. So when you're having panic attacks, this is how you feel. You feel the inability to breathe. I've had panic attacks, so I know how it feels. It's the most horrible thing to experience on earth, I promise you. You feel a shortness of breath. And remember, now during the times of COVID, and now you're having a shortness of breath, and now you're having this dizziness, and you're like, Lord, what's going on? So feeling inability to breathe, a shortness of breath, your chest pains and chest tightening. Definitely, I felt that. Feeling like you're being choked, especially when you're trying to sleep, you're feeling like you're being choked. Increased heart rate and palpitations. There was a time when I thought I've got high blood pressure, because my heart rate was so fast, and I just felt this intense fear that I didn't even understand where it came from. And remember, when we spoke about the risk factors, we spoke about traumas and hijackings and whatnot, and it's all coming from that. Okay, excessive sweating. Some people have hot flashes and chills. I had chills, shaking of body and trembling. This is during a panic attack. Feeling a numbness or tingling sensation in your extremities. That is like your hands or your feet. Definitely felt that. A little tingling in my feet and feeling like they're cold. It's a very scary experience, guys. Feeling dizzy or lightheaded. For me, I would first start feeling dizzy and lightheaded. I'm like, but my iron levels are fine. Then I'll start feeling scared, and I'm like, oh my goodness, what's going on? Then I'll feel these sensations in my feet, and I had a panic attack. Panic attack is an episode. It's not a mental illness or whatever. It's an episode that anyone can have for any reason, especially if you've had a traumatic event, like somebody dying in front of you, being raped, attempted hijack, attempted break-in, or a break-in happening, etc. A lot of things can cause a panic attack. Feeling unsteady, like you're going to faint. You literally feel like you're going to faint, but you're not going to faint. But you feel like, I'm going to drop dead, Feeling disconnected and detached from the world. I think this one came out strongly because of this social distancing and isolation and whatnot. So you feel like you're alone as an adult, or even if you have a guy or your partner, but you don't have your friends. Your life is not normal the way it was, especially before the pandemic. So you do feel a little bit disconnected from the world around you. And another one is just feeling like a sense of danger, that something bad is going to happen. Or another one is feeling like there is an impending death. And I want to stress impending. You feel like you're about to die. You literally feel like you're about to die. So you'll have people When they do have a panic attack, they'll start packing things and writing letters that, oh, these are the codes for this and this. If this happens, this and it's like a little suicide note, but you're not committing suicide. You're just having a panic attack. And during the panic attack, which can last from 5 minutes to hours, you don't know whether you're going to come out of the panic attack or not. So especially when you don't know that you're having a panic attack, you really think you're dying. You can't even convince your mind because you really think you're dying and you're not aware, which is why I want to bring this awareness to people that there is something called a panic attack and this is how you feel. And I've had a panic attack. I've had panic attacks, guys. So I'm not going to sit here and not tell people what's going on. I've had panic attacks, especially I think because of the environmental changes and the support structure and how we were sort of coerced to be in our homes, and we had to be in our homes. We had no choice. And some of my colleagues and friends were going to work, and I saw like when I'd call them how the situations at work are, and some of my colleagues were dying, and then now you're having a panic attack and you're like, am I dying? What's going on? So that's just the things about panic attack. There's something very distinct about a postpartum panic disorder. 3 things that are distinct: the fear of death, even when you're not sick, even when there's nothing that can be traced medically on your body or anywhere on you that is a sign that you're dying. You don't have any illness, you don't have any condition that could cause death. Usually people who have panic attacks do end up at the emergency room and they do take tests. I ended up in the emergency room. They did test on me. They did test on my heart. My heart was functioning well. My blood pressure was fine. Everything was normal physically, but in my mind, I felt all these feelings because of, remember, all these hormones and all the experiences that I had prenatally and postnatally with baby having colic, and then all these changes in terms of the pandemic. So you feel fearful of death. And remember, for those of you guys who know me, I lost my grandmother 2 months ago, and my cousin literally 3 days after my grandmother. So that was too much. And remember, last year I lost a lot of family members, so the idea of death is like zoomed in for me. And remember losing a lot of colleagues at work during the month of June to August. I can never say why they passed away, but this whole COVID anxiety and all of that, I think it was a comorbid thing. But yeah, that can instill fear in anyone, so fear of death and seeing yourself as if you are dying, feeling like you are dying and you're leaving your kids behind. So definitely that will scare you and make you feel, depressed that I'm dying and my baby's like only 2 months, 3 months, Fear of having lost control is the second one, where you feel like you can't get a grip on your own life because you're anxious the whole time. You're anxious, so you can't get a grip on things. Like at work, maybe you're not coping well because you feel like you can't control. When you have a panic attack, you can't control your body. You can't calm your body down. You'll breathe into a brown bag until your body or your hormones decide to calm themselves down. You don't say, hey, body, calm down. So you feel like you're losing control of everything around you because you've kind of lost control of your own body. You're not harmful to anyone or anything like that, but you're experiencing this fear. Okay, now remember. And then the other one is the fear of losing your mind because you're like, what's going on with me? Am I losing my mind? And all of that, So it's important to be aware of all these risk factors, these what a panic attack is, and also some of the signs and symptoms. So having said all of that, let me talk about treatment. So treatment depends on how severe your condition is, your mental health issues, like I said, or your mental illness. Depends on severity. And there are a variety of mental illnesses, guys. Lots of people throw around very loosely bipolar mood disorder, and I don't think they understand bipolar, and I think they stigmatize bipolar and mistreat people that are diagnosed with bipolar, which is so wrong, which is why I always stand up for you know, mental health, because I'm passionate about psychiatry. I'm actually a psych OT at heart, and I'm passionate about seeing children thrive and dealing with children that have disabilities or are living with mental health or mental health issues or mental illnesses, and supporting those parents. So yeah, throwing words around loosely should stop. Know the diagnoses. Know that before a person is diagnosed with a condition, they need to have a series of signs and symptoms for a specific period of time for it to be a diagnosis, so that they'll need to be on medication, or they need to go for therapy with a psychologist, or they need to go for occupational therapy, which is also very holistic kind of therapy, because we look at function in terms of all areas of life, so that you can be able to know your threshold and you can be able to know how to function as a person in terms of the demands of life and the capacity that you have. They may also need to see a social worker if there are social issues around, family or children, etc. And occupational therapists also do work visits, where we go to the workspace and we see what demands the workspace has on the patient, and if that fits in with their capacity, and whether or not they can return to work, especially after they've been diagnosed, or while they're having a mental breakdown or a psychological breakdown or emotional breakdown. We need to check. So there's bipolar mood disorder, there's depression, there's major depressive disorder, there is seasonal bipolar, there is schizophrenia, psychosis, HIV related psychosis, just to name a few that are very common. Personality disorders, which I will definitely talk about during this month. There is, let me think, general psychosis due to general medical condition. There's postpartum, now postpartum depression and anxiety, postpartum depression only, and postpartum anxiety, and then there's postpartum panic disorder. So there are so many. Then with children, there's ADHD or ADD. There is cerebral palsy, which affects the cognitive functioning of the child. I will talk more about this if you guys need me to. There is autism spectrum disorders, which is a range. Even with grannies, there's your Alzheimer's and your delirium and your, what's that other one again? I'll remember it just now. There are so many mental illnesses. If you are interested, do check out the DSM-5, so you can see the variety of mental health, mental illnesses rather. And if you've got questions, you're welcome to DM me. You're welcome to have a conversation with me. I will be doing lives again on Instagram and on Facebook throughout the month of October to raise awareness. Please wear your green ribbon today. So aside treatment, some people may need medication, antidepressants or anti-anxiety medication. They may need some medication for sleep, because remember, they've not been sleeping well. They may need support, so the baby might need to be taken to stay with someone else, or someone might need to come and stay with the mom and the baby, so that they, interchange, so that there's a certain level of balance, and the mom is also given time to do self-care. And I know this year specifically, that has been a challenge because of the pandemic. People have lost their jobs or have salary cuts, and they can't afford nannies. And nannies also need to be with their families, and creches are closed and all of that. So I know this has been a very stressful year, especially to mental health care users and to people diagnosed with mental, and those who don't even have mental illnesses. We've all been stretched this year. We've been stretched. Churches were closed down, so we had no places where we could meet up and, sum up some prayer and strengthen one another, So it was a very, very tough year. We're still in level 1, so we don't know what's coming. So it's very important to grasp what you can during this time. Reach out for support. You may need medication. You definitely will need occupational therapy to balance out your occupational profile or your activity profile, and make sure that you're doing as much as you can without harming yourself mentally or physically. OTs also do physical patients, like your spinal cord injuries, your stroke patients, which is my other passion. So seek the help that you need. Do your research, but do seek professional help. Do not shy away. Do not be ashamed of taking care of your own mental health. That is the dumbest thing you do, I promise you. Do not allow people to control you to the point that you're afraid to reach out for help for yourself. I'm going to say that again. Do not allow people to, be so important in your life that you allow them to prevent you from reaching out for help when you need it. People who are going through a divorce, who are going through any change or any trauma, reach out for support. Do not allow abantu bazothini syndrome to make you end up being in a tough situation, because if your brain makes you feel suicidal, it's not that you really want to kill yourself, but it's the hormonal imbalance, and you might end up doing something and dying, and actually dying, because when you've got this thing ukuthi abantu bazothini. And again, to everyone who's been diagnosed with a mental illness or who've got mental health issues and you are dealing, uyagoa. Don't ungagowi. You're alive. #masipileni. Let's make the most of it. Let's reach out for help. Let's educate people around us. Let's have these conversations. And so today I was talking about postnatal, pre and postnatal mental health issues. Thank you for listening and thank you for watching. I am doing a giveaway. I'm giving 5 women 25% off, right? 3 Zoom sessions. Women who've just had children or have children between the ages of 0 and 2 years. As an honor to Mental Health Awareness Month, I am giving away, as an occupational therapist, 3 sessions at 25% off. We'll be doing them on Zoom, so I can offer support as an occupational therapist and offer some structure and try and help you to get back on your feet, because that is what excites me, to see someone get a grip on their life and be able to get themselves back to themselves so that they can cope better. So the first 5 women, what you need to do, you need to follow me on Instagram. It is at Palesa_occupational therapist. You need to tag 5 people that #October is Mental Health Awareness Month. And that's it. And then you DM me your details, and then I'll DM you the Zoom details, and we do our 3 sessions at 25% off. Having said that, happy Mental Health Awareness Day. Please wear your green ribbon. And I know my talk was very long, but I hope it was informative. You can reach me on Facebook. You can DM me on Facebook. You can reach me on Instagram. It is at Palesa_occupational therapist. And I think my numbers are all over the place. So you can send me a WhatsApp. It's 071-154-4658. Other than that, have a beautiful day. If you're having a difficult morning, remember it's a difficult morning. It's not a difficult life. You can make it happen. From your favorite therapist, I'm out of here. Bye.